Hi, I'm Matthew Sermont, and you're listening to the UChicago Public Policy Podcast.
Welcome to the University of Chicago Public Policy Podcasts. This is UC3P, our eponymously named podcast on policy, politics, and current affairs. My name is David Raban, and I'm the production manager for what we like to call the main page. Today, we wrap up our mini-series exploring the crisis surrounding COVID-19. We speak with Dr. Raghuram Rajan about what's happening and what's going to happen with our economy. Dr. Rajan is a former head of the Reserve Bank of India, which is India's equivalent of the Federal Reserve, and is now the Katherine Dusak Miller Distinguished Service Professor of Finance at the University of Chicago Booth School of Business. Before we get into the interview, a few notes. First, we recorded this interview on Friday, April 24, so for the last time, please continue to bear with us as the situation rapidly changes. Second, this episode ends our mini-series, but that doesn't mean we're going to stop talking about the coronavirus. You should expect that as we wrap up this academic year and then begin again in the fall, you will hear more from us about COVID-19 and its effects. Finally, if you enjoy this episode or any of the previous episodes on COVID-19, please make sure to tune in this Tuesday when we'll begin our newest miniseries on gun violence, the other epidemic. Now, let's get straight into the interview. Without further ado, here's our expert on the economy, Dr. Raghuram Rajan.
Welcome to UC3P, the University of Chicago Public Policy Podcasts. My name is Sidhant Wadhera.
And my name is Arjun Motta.
Today we have the pleasure of speaking with Dr. Raghuram Rajan. Dr. Rajan is the Katherine Dusak Miller Distinguished Professor of Finance at the Booth School of Business here at the University of Chicago. From 2003 to 2006, he was Chief Economist and Director of Research at the International Monetary Fund. From 2013 to 2016, he was the Governor of the Reserve Bank of India, which for listeners who don't know, is similar to the Chair of the Federal Reserve here in the United States. Dr. Rajan, thank you so much for joining us.
Of course, pleased to be with you.
We are speaking to Dr. Rajan on Friday, April 24th. As a result of COVID-19 and the associated policy responses, over 26 million people have filed for unemployment in the United States. Around the world, there has been a cessation of economic activity to ensure public health and safety. With billions of people hurting economically, we want to focus our conversation on what happens next. Dr. Rajan, in terms of the economic contraction, how has COVID-19 to this point compared to the 2008 financial crisis? And looking forward, how do you think it might compare to 2008?
Well, it's certainly been deeper and more rapid. Think of the unemployment numbers we've seen, 26 million unemployed in the US, all within a few weeks. So the contraction has been much sharper, and the consequent contractions to trade are going to be also equally sharp. There are a number of differences, of course. During the global financial crisis, people could still go to work. There was just less work. Here, we have large parts of the population unable to go to work. So even if they're employed, they're not actually at work. Also, the crisis was centered around the financial sector and then spread to the real sector. This time around, it's centered in the real sector and has not yet spread to the financial sector, though that is always a possibility.
Dr. Rajan, governments around the world are engaging in some combination of fiscal and monetary stimulus measures. Are there any countries that stand out in terms of good or bad economic response? And if so, what are some of the measures that they've taken?
Well, it's hard to say at this point because it's hard to compare the specific measures each country has taken. I mean, broadly speaking, what Northern Europe has done is essentially tried to keep people in their employment by subsidizing employment. So even though people aren't going to work, they're getting paid perhaps a reduced amount, but they still have a job. In the US, there was an attempt to do that with a paycheck protection program. But I think as of now, with these unemployment numbers, a lot of firms are letting people go. there are good sides and bad sides to it. On the one hand, unemployment insurance has been increased in the United States for the next 3 months. And so people who don't have a job are not as badly off as if they were dependent only on the traditional unemployment insurance. Moreover, if the pandemic requires you to move from your old place of employment to something new because the economy has changed, for example, it's unlikely that restaurants will come back in the same volume as before. And maybe the people who were serving as waiters and chefs are better focused on, for example, contact tracking, which is a new job with this pandemic. So given that, the US is probably better placed for the dynamic changes that are required, while in Europe, they will stay with their old job for a few months, and then eventually, when things start coming back, may discover that their old job no longer exists, at which point they will have to move. And so there may be a slower process of readjustment there. So there are good things and bad things about every program. What is true is that industrial countries have been able to put in place a massive program of the order of double digits of GDP, while emerging markets, even China, don't have that kind of fiscal space, that kind of ability to spend, and have been far more parsimonious. Of course, the worst hit are the developing countries, the countries in Africa, for example, or some countries in Latin America, which simply do not have any kind of spending ability and in fact are faced with large amounts of debt. And there the government reaction has been much, much weaker.
Building on that, there has been a lot of criticism in the United States that our monetary and fiscal policies are aimed more at supporting large corporations and shareholders rather than the poorest among us. Are those critiques valid? And if so, can the response be tailored to the vulnerable populations?
Well, I think it's too early to make that criticism. There have been significant programs rolled out at buffering individuals. We talked about the Paycheck Protection Program, which is aimed at small and medium enterprises. Yes, a few large enterprises have snuck in, and those deserve to be ejected from the program. But this has been an important program for small and medium businesses, and a large number have benefited. Similarly, there's been direct cash transfers to individuals, the $1,200 per person. There's also been an attempt to increase the size of unemployment insurance. So I think compared to the measures that were put in place after the global financial crisis, this is much more focused on Main Street, on the common person as compared to that one. This is not focused primarily on the rescue of large corporations. That said, given the market for financing for large corporations has become very tight, there are measures for the Fed to help those large corporations get financing. Everything has an acronym or a name. I think this is a Main Street financing or something like that. It's obviously political. It's an attempt to say this is not about the large corporations, it's about Main Street helping people have jobs. But the reality is, in this kind of environment, it's quite important to maintain liquidity in financial markets. The Fed has gone out on a limb to do that. And again, we will find some aberrations with the benefit of hindsight, things they shouldn't have done. But I think by and large, they've tried to stay on doing reasonable things to keep the economy together over the period it is in suspended animation.
Another critique that you've heard from some voices is that the government responses could potentially cause an explosion of budget deficits. Do you think that's something that should be top of mind right now? If so, to what degree, and maybe why or why not?
So I think it's a mistake to think that deficits don't matter at all, that spending doesn't matter at all, and that in this environment, nobody's keeping tabs. I mean, ultimately what happens is this adds to the national debt, and that national debt is not going to be paid off by this generation. It's going to be paid off by you, younger generation, as well as the generations that follow. So you have to be very careful, because those are also the generations we're going to rely on to pay for our social security and our healthcare. You can't overburden them. So at the same time, it is not in their interest to have an economy which collapses and has no ability to pick itself up for many years. So you have to spend what is necessary in order to keep the economy together. but don't spend on all the old sort of, spending needs that you accumulated over time just because at this point nobody's looking. You want to be very careful that what you're spending on is strictly necessary to keep the economy together. And that's why the phrase one should use is this particular act of spending is going to make sure the economy revives or is going to make sure that people can keep body and soul together, but it is not meant as compensation. That is the idea that you would compensate anybody simply because this was unexpected is a bad idea, because we're all victims of the coronavirus in some way, some more, some less. But this is a shock which has hit all of us, and you can't compensate for a shock which hits everybody. How do you choose who to compensate and who not to compensate? What you can do is, I'm going to give you support because it's necessary for you to keep going on. It's necessary for this firm to keep going on, otherwise it'll collapse. And even there, after a certain while, we'll have to start making choices.
You referred to spending on what is necessary. Are there any things in particular that you see as being necessary that maybe aren't being fulfilled right now, or things that are being fulfilled right now?
Well, we'll have to see as it goes, because there will be people who aren't being supported. For example, the gig economy workers, they were people that it was very important to get money out to because they had no money to pay their bills, to buy food and so on. Are they being supported, or do we have to find out ways to reach them? All this was done in a hurry. So we have to then, look at what actually is happening. Are all the small entities that were looking for money, did they get what was appropriate? Again, blanket form of support for the entire economy is possible for a little while, but we should make sure it reaches everybody. And then over time, we'll have to start making harder choices if this persists.
You've been listening to our conversation with Dr. Raghuram Rajan, Professor of Finance at the University of Chicago Booth School of Business. We'll be right back.
Hey, thanks for listening to UC3P, the main page. We know you're enjoying this episode, and we really want to get you back to it as soon as possible. The problem is, if you're listening to this, there's a really good chance you haven't subscribed to the show yet. Don't worry, that's super easy to fix. Just go on your phone, pick your favorite podcast app, and type in UC3P or the main page. It's easy to subscribe, and we know you don't want to miss any more episodes. Again, type in UC3P or the main page and subscribe. Now go tell a friend.
I'm Sidhant Wadhera.
I'm Arjun Motta, and we're back with Dr. Raghuram Rajan. Dr. Rajan, based on your experiences at the IMF, what do you think should be the responses or interventions of multinational institutions at a time like this, as opposed to actually elected states?
There are states that have no support. They're very poor. They have built up a lot of debt. They may be states that thrived on tourism, on commodity exports, have basically one industry, maybe an export industry that functions in normal times. All those trade, tourism, commodities, all those are dead right now. And so if this country has a fair amount of debt to deal with, it's really in a deep hole. And if in addition, its medical facilities are poor to begin with, and it has the coronavirus, which doesn't respect either poverty or wealth, attacking it, they need to find some ways to ramp up their medical capabilities. This is the problem facing many, many poor countries. The IMF the other day said nearly 100 countries had applied to it for help. And so it's quite important that we roll out that help. Again, not asking really, are you going to put in the right conditions to change the nature of your economy? Why is it that you're so stretched now? Right now, the problem there is a humanitarian one. How do we make sure that they have enough resources to fight the virus? We can deal with some of the other issues down the line. I mean, maybe they also need a little bit of money to keep their firms and industries alive in the same way as we are doing it here. That certainly also needs to be considered. But really, what we're talking about right now is relief, which is different from the normal forms of aid. This is about relief in the face of a cataclysm. And therefore, I think it's quite important to consider their needs and to make sure we can meet it quickly. Again, time is of essence. If you don't have the medical facilities in place early enough, you're swamped by the virus. We've seen that happen in the United States, in New York. So it's not something that, given what we know, we should actually let happen in those countries.